With the text-based negotiations on the agreements on trade-related aspects of international property rights set to begin soon, advocacy groups and civil society are concerned. The Health Justice Initiative says talks and texts should not be delayed for months, and the negotiations must be made available for the public to follow.
Learned from past lessons, particularly around how the Doha Declaration was negotiated. We can't basically wait for months for this waiver to be finalized and for the text to be finalized. It needs to be transparent. Civil society needs to have a seat at the table. You can't defer only to pharmaceutical interests and to vested interests and to, well-funded lobbies in the negotiations. And also it can't be watered down.
Doctors Without Borders says South Africa and India have already worked on a revision text. However, there are rumors that the United States is working on text following the announcement supporting the waiver proposal. With the current approval systems, there's a lot of pressure on the text-based negotiations.
For this particular waiver, we still don't know from our understanding, the proponents and others, the sponsors are not ready to test the voting system yet, meaning that this is still need to be nobody say no. This is scenario. So the negotiation, even if start, will still be a quite heavy process.
Who says the surging numbers in COVID-19 infections in India is a good example of why this waiver approval is important.
We know Russia issued a compulsory license on remdesivir, allowed generic production. And then recently, we also know they got sued by Gilead. Gilead didn't agree with this compulsory license. They sued the Russian government. So, and India is in a very bad situation, as we know. So reportedly that the Russian government and the company trying to send some humanitarian aid supply to India, including generic medicine produced under the compulsory license. But then it was delayed.
Hassan believes if everyone is to be allowed access to vital medication beyond COVID-19 drugs, there needs to be proper and healthy competition in the pharmaceutical industry.
When we talked about the untapped production capacity and the untapped manufacturing capacity that the WHO is also identifying, you see, this is where these companies could be granting multiple voluntary licenses. And it links to Mia's question earlier about the HIV/AIDS situation, where government would only negotiate for Aspen to get a license as the preferred provider. And we always said that you need multiple suppliers and multiple manufacturers, because even amongst generic manufacturers, there needs to be competition. Even generic manufacturers, are interested in profit in markets.
The WTO chief, Ngozi Okonjo-Iweala, has urged the proponents of the proposal waiver to submit revised documentation as soon as possible so that the negotiations can begin soon. Namapolani, SABC News.